Hi everyone, my name is Naomi. I'm a myofunctional therapist, and today I want to talk to you about the REMplenish Nozzle water bottle. This product is really great. We actually include this product in every single case of myofunctional therapy that we do, and I've seen great results with this product. It helps reduce snoring, it helps with better sleep, nasal breathing, and improved tongue posture. How this water bottle does all that is it just helps strengthen up the back portion of your tongue. A lot of times people will start to compensate by using just the front portion of their tongue and their cheeks a lot to swallow. And if you're not doing a proper swallow throughout the day, those muscles in the back portion of your face are going to start to atrophy, and it can really affect your airway. So by using a product like this, you're strengthening the back portion of your tongue and also strengthening up that airway to reduce snoring and just really help with your overall wellness. The goal is actually to have your tongue suction to the roof of your palate all throughout the day. And why that is because the tongue actually holds the whole lower jaw in place. So when the tongue is gently suctioned up in the roof of the palate, the whole lower jaw is supported throughout the day. And then when you lay back to sleep, it actually holds your lower jaw forward and protects your airway so you're able to nasal breathe at night, which is more optimal for sleep and oxygen intake. In the rare case that you experience pain in the jaw or the facial muscles when using this product, could just be a sign that you're trying to use the product a little bit too fast. My recommendation is that you just drink a little bit every day and kind of work up to that muscle. Another thing that could be happening is you could have some tight fascia in your face, possibly holding down the tongue so you're not able to get that proper swallow. So if you have fascia holding down your tongue, which can be called like a tongue tie, and holding down the tongue portion, especially in the posterior portion, then when you're trying to do that proper swallow, you're not able to really get that back portion of the tongue up. So you're having to compensate with other muscles of the face. This is an instance where getting checked out with a myofunctional therapist or someone who is trained to actually diagnose a tongue tie or oral ties is a great place to start, because you can actually address what's really going on. Working with a myofunctional therapist and the REMplenish products is a perfect combination. If you don't have access to a myofunctional therapist, this is a great product that you can start using at home. I am going to demo how to use the water bottle. So I'm going to seal my lips around the base of the straw here, and the tip of my tongue is going to push up and squish this part to the roof of my palate. So the tip of my tongue is squishing the straw up, and also the middle portion of my tongue is squishing this middle portion up. So it's pushing the silicone nozzle to the roof of my palate, and when I'm sucking water through the straw, I'm not going to move the tip of my tongue. So the tip of my tongue is going to anchor behind my front two teeth, and it's going to stay anchored there while I'm drinking. So it's actually the back portion of the tongue that's going to be pulling the water on the roof of my palate, and using the back portion of my tongue to suction up and send the water backwards. Start small, just start with small portions of water. Even if you're drinking just a little bit each day, you're strengthening that back portion of your tongue. You're gonna start to notice that you don't need to use your cheeks as much, that your tongue is actually the muscle that's going backwards. And one thing to think about too is, where's the tip of my tongue? Is it anchored and staying there the whole time? Or is my tongue thrusting forward? That's what we don't want. We want the tip of the tongue anchored, the back portion of the tongue moving. We don't want the tip of the tongue pushing forward. That's called a tongue thrust, and that is what this product is trying to prevent you from doing.